Scaffold Renu Training. This video is to aid your understanding as to what Renu is, how it works, and for the cases in which it is used. From this point on, we will refer to the product as just Renu. Renu's indication is as a bone void filler, like that of many other grafts on the market. To reiterate, this is to fill bony gaps or voids in the skeletal system, extremities, posterior-lateral spine, and pelvis. These are not intrinsic to the stability of the bony structures. These may be surgically created or created from traumatic injury. Disclaimer: Renu is not indicated for vertebroplasty or kyphoplasty procedures in the spine. Renu, as a graft, would be categorized as a mineral or ceramic-based bone graft substitute. As a reminder, grafts in this category include calcium phosphates, calcium sulfates, bioglass, hydroxyapatite, and other ceramic-based materials. Renu is a composite ceramic graft. It combines two ceramic qualities, that of an alpha TCP or alpha tricalcium phosphate graft combined with calcium sulfate. As a review, let's look at the qualities of each one of these ceramics. First, we'll look at calcium phosphate bone graft substitutes, and in particular, alpha TCP. Alpha TCPs convert and set in vivo via a chemical reaction resulting in a porous hydroxyapatite matrix. Again, this is similar to the mineral phase of bone. The advantages of a graft of this type is its similarity to native bone. Most have strength similar to bone or more. Some are drillable. They remodel naturally. There's no strength deficit during healing. They're excellent for augmentation. They provide immediate and long-term mechanical strength, and by themselves they are osteoconductive. Some of the disadvantages of using a graft like this alone is that it can be finicky or temperature and time sensitive. The mixing process may be cumbersome, and they remodel for what some surgeons deem a long period of time of 3 to 10 years. Reviewing the algorithm for alpha TCP, we see that biologically it is osteoconductive. Structurally, they're at a low end of bone or much higher than bone. Chemically, they're similar to bone. They convert to HA in vivo. Surgical handling qualities include injectables, blocks, wedges, and putties. And again, the remodeling time is 3 to 10 years. In review of the other ceramic in this graft, we look at calcium sulfate, which is gypsum, or a hydrated form of plaster of Paris. The advantages of a graft like this alone: it is not affected by temperature. It is mostly isothermic, although it does have slight exothermic reaction. Mechanical strength similar to cancellous bone early. Disadvantages include it dissolves very quickly, on average 2 to 12 weeks. Loses strength within days. It is not similar to bone. It has no biologic component. Has been known to have drainage at the surgical site. It is 30 orders the magnitude more soluble than bone. We see that biologically it offers very little. It may be osteoconductive for just a couple of weeks. Structurally, most of these grafts short term will be similar to that or a little higher than bone. Chemically, they are not like bone. The handling properties include injectables and granules and morsels. Remodeling resorption time, and in this case resorption, is 1 to 3 months on average. Now that we've reviewed the algorithms for each of the products alone, let's combine them and see what kind of graft is made. Biologically, we have now an osteoconductive graft, much due to the alpha TCP in the component. Structurally, we have a graft that is similar in strength to bone. Chemically, what results is a like bone alpha TCP converting into a very macroporous hydroxyapatite matrix. The handling qualities of this graft is that it is injectable and in a putty form. And the remodeling time of a graft like this is on average 1 to 2 years into new bone. Other properties of this unique combination graft include it is isothermic, during which the temperature remains constant. There is no temperature change in this graft. Porosity is 50% macroporous, a very unique porosity. The picture on the right of the screen offers an example of what this graft might look like in a magnified image. This is a hard-setting product that cures anywhere from 1 to 3 days, or 24 to 72 hours. And, as a note, it is not adhesive. First, we'll look at compressive strength. Renu shows strength characteristics similar to that of native bone at about 15 megapascals. When reviewing the tensile strength of Renu, we see it measures at 2.5 megapascals. While this is at the low end of bone, it is higher than most grafts on the market except for scaffold. To review, the alpha TCP will convert into hydroxyapatite. This is similar to the mineral phase of bone. Renu, being a combination graft of alpha TCP blended with calcium sulfate granules, creates a unique remodeling and resorbable graft. The first phase is the resorption phase, which occurs in the first 4 to 12 weeks. In this case, the sulfate will leaving large pores within a calcium phosphate matrix, which is, at this point, hydroxyapatite. Normal remodeling of the entire construct then continues into phase 2. In phase 2, this resulting macroporous hydroxyapatite, which is now a vascular graft, allows for outside-in and also inside-out graft remodeling. The implanted material should be around 50% remodeled in about 6 months, and typically takes around 1 to 2 years to completely remodel into new bone. On the screen now are images that illustrate this process. On the left-hand side, we see a scanned electron microscope image showing the porous nature topographically on this graft. On the right-hand side, we see a histological picture at 4 weeks showing the graft site, the porosity that's occurring, and the remodeling that is ensuing already. On the left-hand side, we see the pure alpha-TCP at 4 weeks. In the middle picture, we see a pure calcium sulfate at 4 weeks. And at the right, you see the result of combining these two grafts. What remains is a 50% macroporous, interconnected hydroxyapatite matrix, which will allow for faster remodeling. In this series of images, we see examples of the remodeling and resorption process. At day 1, a cured hydroxyapatite matrix is exhibited. At day 30, we see that the sulfate has mostly resorbed, leaving a very macroporous vascular graft. And at day 60, we see that bone infiltration and remodeling has already occurred, and the graft is remodeling inside out and also outside in. Let's learn now how Renu works. First, Renu comes in 2 delivery options. The first and most commonly used version of Renu is Renu Flow, an injectable paste. It comes in 5cc and 10cc sizes. Each kit contains pre-measured powder and liquid vials, custom rotary mixer with plunger, 10 milliliter syringe, and an 8-gauge delivery cannula. The other option for Renu is Renu Impress, a moldable putty. It comes in 5cc and 10cc sizes. Each kit contains pre-measured powder and liquid vials, a custom rotary mixer, and a plastic spatula for removing the material. These tips will aid you in having successful outcomes with your surgeons when utilizing Renu. It is critical to make sure the vial of liquid's temperature is below 70 degrees before starting. Always chill the box or the liquid in a refrigerator or freezer if in doubt. Please introduce the heated saline onto the table just prior to mixing and implantation. Follow timing charts closely. Cover Renu with heated saline immediately after implantation. This is critical for the product to set properly. It needs to set at 90 degrees or above. Now that we understand the properties of Renu, let's learn how each version is used. Renu Flow is an injectable paste that comes in 5 and 10cc sizes. The first is the powder and liquid set. There will be a perforated tear to help in removal of these materials. One side houses the powder, the other side houses the liquid. The next package contains a mixing chamber, a plunger, and a 10cc syringe. And lastly, a package will contain one 11-gauge delivery cannula. Now that you have all the materials on the sterile field, you can begin the mixing process. It is critical to make sure the surgeon is ready to use the product, because once you start mixing, the time begins and there is no turning back. It is critical at this point to ensure that the bottom or base of the mixer is above the side port. If it is not, the liquid will pour right out and you will have to get a new kit. The first step in the process is to remove the liquid vial. Empty the contents of the liquid vial fully into the mixing chamber. Gently tap the side of the vial with the syringe to ensure all contents have been removed. In the next step, remove the cap from the powder vial. Now gently tap all the contents into the mixing chamber. Now begin a 1-minute timer. The product should be mixed vigorously for 1 minute or 100 rotations. At this point, the product is thoroughly mixed. Now you will have up to 5 minutes to load the syringe and get ready for implantation. Now that mixing is complete, unscrew the top of the mixer and scrape the Renu Flow from the mixing paddle back into the mixer. Rotate the base of the mixer all the way down in a clockwise fashion. The port is now half exposed, as you see here. Now insert the plunger into the mixing chamber at a slight angle. Then rotate the plunger down until Renu flow starts to extrude slightly out of the syringe port. Remember to remove the syringe cap before affixing the syringe on the port. Then continue rotating plunger until syringe is filled. A tip: it is best to do this quickly. It will help ensure more material is pushed into the syringe. Remove syringe from port and reattach cap. Remove the trocar from the cannula. Attach the cannula to the luer connection of the syringe cap. Now the surgeon will implant and manipulate the material. They will have up to 2 minutes to do this. Regardless of how much time it has taken to transfer the material, just prior to implantation, start a new timer. It is important during implantation that the surgeon fills in a retrograde fashion. Now the product is ready for implantation. The surgeon will have up to 2 minutes to inject, implant, and manipulate the product within the void site. Once this 2 minutes is done, the surgeon should stop manipulation. The product is hardening, and any further manipulation may fail the case. Remember, Renu is crystallizing. If you break the crystal formations, you will compromise the long-term mechanical structure of the product. It is important at this time to get the material over 90 degrees. To do so reproducibly, always have heated saline on the table at this moment. Dip a lap or Raytec in this warm saline and cover the void site. Bathe the implantation site every 30 seconds gently to ensure that the material is setting at or above 90 degrees Fahrenheit. Once your timer reads 10 minutes, the product has set. Set means the product will not move from where it is and can be irrigated and the surgeon can close. The next delivery option for Renu is Renu Impress. Again, this comes as a moldable putty in sizes of 5 and 10 cc's. Each kit contains all sterile packed materials. Each of these kits contains a pre-measured powder and liquid vial set, a rotary mixer, and a plastic curved spatula for removal of the material. Now that all your sterile contents are on the surgical field, it is okay to begin mixing Renu. Once again, ensure the surgeon is ready to use the product. Once the contents are put together, the clock begins and there is no turning back. The first step in the process is to remove the liquid vial. Empty the contents of the liquid vial fully into the mixing chamber. In the next step, remove the cap from the powder vial. Now gently tap all the contents into the mixing chamber. Now begin a 1-minute timer. The product should be mixed vigorously for 1 minute or 100 rotations. At this point, the product is thoroughly mixed. You will now have up to 3 minutes to transfer the material. Now remove the lid from the mixing chamber. In doing so, please scrape off any material on the side of the mixing chamber. Now take the curved end of the spatula and now collect all the material inside the mixing chamber. The material is now ready for implantation. Once manipulation and implantation are complete, it is critical to get the material at or above 90 degrees Fahrenheit. To ensure this, dip a Raytec or lap into warm saline and cover the implantation site. Over the next few minutes until the material is set, it is helpful to bathe the material every 30 to 60 seconds to ensure proper setting. Once a total time of 10 minutes has accrued, it is then okay to irrigate and close. There are several areas of the body and procedures where Renu is not an appropriate or indicated graft. Some of these include non-unions, fusions, diaphyseal fractures. It should never be used in an open physis or growth plate, and never should it be used in a vertebroplasty procedure. Where is scaffold Renu best used? Typical cases where Renu is best used include trauma and fracture cases, typically in the metaphyseal areas of bone, total joint revisions, autograft backfilling, and tumor and cyst voids. Which doctors would utilize a product like Renu the most? Those would include orthopedic trauma doctors utilizing it in fractures of the tibial plateau, proximal humerus, acetabulum, calcaneus, distal radius, to name a few. Oncologists utilizing scaffold in tumor, cyst, and osteolytic voids. Hand and upper extremity surgeons can utilize scaffold in distal radius cases and chondromas, proximal humeruses. Foot and ankle surgeons have many uses for scaffold, including the calcaneus, wedge osteotomies, when utilized with autograft, and cysts. And joint doctors use it for acetabular cup revisions, tibias, and glenoid voids. Now let's look at the type of cases where Renu is used. In these two images, we see that Renu was used to fill a void associated with a distal radius fracture. The image on the left shows Renu just after 1 month. You can see the radiopaque area, which is Renu, and it has filled the distal radius void. The image at the right is a 12-month post-op X-ray. Here we see the vascular macroporous nature of Renu has resulted in fast bone remodeling. As we see in this image, nearly 75% of Renu has been replaced by host bone. These results prove that Renu is a unique graft, one that combines both strength and fast remodeling properties. Renu is a great graft to use for oncology cases, like in this atypical cyst of the calcaneus, or as seen here in the proximal tibia for a giant cell tumor case. As you can see from the information provided in this video, Renu is a very unique product that presents the surgeon a wonderful tool for reaching clinical goals to get patients back on their feet as soon as possible. Scaffold Renu is truly a unique combination mineral graft. It combines vascularity with a strength profile similar to that of bone, thus creating a strong, fast remodeling graft. We hope this video has provided you with a baseline education for selling Scaffold Renu successfully and improving patients' lives.